Welcome to the Nursing Dose with Farah. Welcome to the podcast as well. For those who are watching, I'm streaming on YouTube, Facebook, LinkedIn, and Twitter. Please say hello. Let me know where you're watching from in the comments. Drop any questions or concerns that you may have. And again, thank you so much for joining. Wanted to do this quick pop up live to talk about how to be a critical care nurse. So there's a lot of graduates recently, right? You may have graduated in like March, April, or you're about to graduate in May. So shout out to all my nursing graduates. Very proud of you guys. Big, big, big time to enter nursing. So there are so many different opportunities, but I want to talk to you guys today about, or talk to you about how to be a critical care nurse and really what that means, who really should be seeking out these opportunities in either the emergency department or in the ICU. And I know there's a lot of nurses who are drawn to these areas, but I want to make sure that you understand that what you require to work in these areas, and it is definitely possible. So I just wanted to share that. So we're going to go through a couple of things. Number one, just a quick background. I started out in the emergency department. Again, I don't think I introduced myself, but my name is Farah Laurent, Dr. Laurent, aka Nurse Career Coach. Just graduated from my doctoral program in organizational leadership. And my background is in education. I have my master's in education and, of course, my bachelor's. I went to school in Canada. And when I graduated, or even before I graduated, I always knew that I had an interest in the emergency department. I used to watch Trauma Life in the ER. I loved that show. And my clinical instructor asked me what type of nurse I wanted to be. And I said, I want to be an ER nurse. And she told me, absolutely not. You'll never be an ER nurse. You're too unorganized and you should start in med surg. I didn't want to. I hated med surg. I knew that I wanted to be in a fast-paced critical care area like the emergency department. So, of course, I pursued it. I applied as a nursing student. In my last rotation, I got to go to the ER, and I got hired. Started working in the ER 2 days after I graduated. So this is what I wanted to share with you because there are so many nursing students that I speak to and new graduate nurses that are told that they have to start in med surg, and I'm just really stressing that you don't have to. If you are interested in ICU or in the emergency department, it is possible to get in. You just have to position yourself for success, and I'm going to talk to you about how to do that. Or if you happen to be watching this and you're a nursing student and you're early on in your journey, I still will talk about how to position yourself for success when you do graduate and how to land a job in the critical care areas such as ICU or the ED. What's up, Alice? Hey, Alice. This is America's favorite nurse, Alice Benjamin. Thank you for coming through. Nice to see you. So Alice is very active on social media. I'm going to be part of her Media RX training master class type training that's going to be happening in June. So definitely check her out. Follow Alice. Thank you for coming through. I appreciate it and saying hello. And if you happen to be watching, don't be shy. Say hello. Let me know if you have any questions or comments. And Alice is also a nurse practitioner in the emergency department. So shout out to you. So let them know, Alice, any tips that you may have for getting into the ER, because that's what we're talking about today, how to be a critical care nurse. So I wanted to start out with if you're a nursing student, and this also is applicable to any nurse watching out there who's maybe an experienced nurse that is maybe tired of the particular area that you're in. And you don't even necessarily just have to be working in the hospital. You can be in the outpatient setting or in the community home care. And maybe you're interested in critical care and you've always wanted to do it. Let me tell you, you can do it. You'll get trained. You'll get the proper orientation. You just have to pick the best organization to work at. So it is possible. Excuse me. Because there's a lot of nurses who are afraid to get into critical care, but you can. Excuse me. So I know I speak to different nurses and they think, oh, I've been in the hospital too long, or I don't know if I can handle it, or whatever the case is. But it's like riding a bike, right? You could just get back on and you're going to get the exact training that you need. You're welcome. You're welcome, Alice, for the shout out. Thank you for shouting me out when you're on your lives. So let them know, Alice. Let them know some tips that you may have for them getting into the ER. So, as a nursing student, I would definitely say choose to go to high acuity areas. And if you have the ability to go into the ICU or the ER as your last rotation, I would say definitely talk to your professors, talk to clinical instructors, and see if you can be put in those areas as your last rotation, because it's very important where you do your last preceptorship or whatever you call it, rotation, because you can start making those great connections with people there, and you can even apply there, right? Also, if you're a nursing student, I would highly recommend, if you're able to at least get a per diem or a part-time job in a hospital setting if you're interested in critical care. You don't even necessarily have to, go the PCT or PCA route, like to be a nursing assistant or a patient care tech. However, if you can get one of those roles, it would help you because you're directly providing care to patients, and it's going to give you such a foundation for when you get into nursing, and you're going to be familiar with the terminology of the hospital, collaborating with different health professionals. So I would highly recommend to be either a nursing assistant or a PCT, especially in the ER. If you're in the ER, you can do, depending on some states, there's certain things that you can do. Sometimes you can do phlebotomy. You could do blood glucose checks and things like that. So you're kind of be ahead of the game if you're already working in a hospital setting. So that's that. And let's say maybe you can't get into the ICU or ED as a PCT or CNA. You can get another job. For example, a patient transporter. That would be an amazing job, because not only are you meeting people in different areas, but you're still having somewhat a kind of a interactions with patients, and you're able to be in the hospital. And then once you're in the hospital, you can make great connections because HR already knows you, they have your paperwork. So when it comes time for you to graduate, you can start making those connections way before. And if you're already there, you can walk up to the manager and say, hey, listen, I'm interested in the ICU, or I'm interested in the ED. I'll be graduating at such and such date. Please keep me in mind. And you can build those relationships that way. All right, let's go to see what Alice is saying. I know she's got some good stuff. Cool. To enter the ER, you must have your ACLS, know your stroke, MI, trauma basics, and be open to learning. Be a good communicator and proactive. Yes, so I highly suggest that. Like I said, I'm a nurse career coach, and what I do is I help nurses get into positions that they want and their dream roles, right? So some people ask me this. They're like, well, should I get my ACLS because the hospital will maybe already provide it? I say go ahead, because it puts you ahead of the game and it shows that you're proactive. So if you get your advanced cardiac life support, you'll be a desirable candidate. Also, find out if the hospital you want to go to has pediatrics, because a lot of emergencies do have a separate peds ER. Some of them are combined. So you want to see that. You want to see if that hospital has the nurses rotating to peds regularly, or if the ER is structured that the peds nurses just stay in peds and take care of ER peds patients. So it doesn't hurt to just get your PALS if you're not sure which hospitals you're going to be applying for. So then it makes you more marketable to have PALS in case the pediatric advanced life support, because again, you're going to be ahead of the game. You should also look into different things, like some places have like IV certification classes, EKG, things like that. because it's very important if you can build up those skills. Um, okay, so she says, know your EKGs, please. This isn't always a dedicated teletech. So, two things about that. If you are interested in working in an ICU or ED, when you're in your clinical settings, ask your clinical instructor how to put somebody on a cardiac monitor. So maybe you're on a telemetry floor. That would be a great place. Like, say you can't get the ICU and you can't get an ED rotation, because I know it's very difficult for some schools. I would say ask for telemetry as one of your top choices, because telemetry is actually very close to critical care, because a lot of times they're doing different drips, cardiac drips. They have patients that are going into crazy rhythms like rapid AFib, or having ventricular tachycardias and things like that. Or they have STEMI patients, right? Depending on how stable they are, or NSTEMI patients, right? So learning how to read an EKG, right? A 12 lead EKG is very important. So make sure to study up on that. And then learning how to actually do an EKG is also very important. So great tips. Okay, what else? All right, cool. So you definitely want those skills. Something else that I'm a big advocate for is joining certain organizations. So let's say you want to be an emergency nurse, you need to join the ENA, the Emergency Nurses Association. And you don't have to be a full-fledged nurse to join. You can be a nursing student and still join. I actually checked out their website. I'm a member myself of the ENA, and they just changed their structure, their membership structure. So now they offer a discount for nursing students. And if you happen to be part of the National Student Nurses Association, the NSNA, you actually usually get discounts on most organizations. So find out. Also, if you want to go into critical care from the ICU perspective, you can join the AACN, which is the American Association of Critical Care Nurses. And again, check out their website. They have other opportunities that you can go to conferences. They have a lot of educational material for you. So definitely check that out. And okay, we have someone else here. Okay, what's up, Connor? Connor from Canada. Yes, I learned that in a step-up unit before going into ICU was so helpful. Yes, EKGs and reading just rhythm strips is very important, because even if you're on a tele floor, like I said, you'll learn so much. And it's an easy transition if you're interested in going into the ICU or the ED. All right, what else? Be involved within the nursing community on LinkedIn too, network and connect. Yes, absolutely. You want to position yourself for success. So even if you're a nursing student early on, I would say start connecting with other recruiters on LinkedIn. Tell them that you're interested in the ICU or ED positions, um, and connect with other ICU nurses or former ED nurses. I also was an ICU educator for a short time. So definitely that's a great tip. Network, use LinkedIn, and connect. The other thing about LinkedIn, I would say definitely make sure you have a profile photo, that you write something in the about section. Your headline is very important as a nursing student. It's very easy if you're a recruiter to find out who's interested in what if your headline says something like aspiring emergency nurse or aspiring ICU nurse. So it's very important. Also, if you're maybe interested in the ICU or ED and you're not sure kind of what it's like, and you're like, I don't know if I can commit to this. I don't know. It kind of scares me. What you can do is you can ask for a shadow day. So whether you work there or not, or whether, you could just ask someone or maybe a clinical instructor, say, hey, listen, I know that we're on whatever unit, but can you please see if I can shadow a nurse maybe in the ED for a couple hours just to see how it's like, or in the ICU. And I've done that before with my nursing students. You just have to obviously speak to your instructor, your professors, and see if they can make it happen. Also, What else can I say? Talk to other, right? Get a mentor or get a career coach like myself, right? That can walk you through this to give you clarity as to what you want to do. Because I talk to a lot of different nursing students, and some of them say that they're interested in both areas. And I always say that's great. They're both critical care, right? But I wrote a LinkedIn post about this the other day. They can't be any more different than each other in certain ways. In certain ways, they are similar. So obviously, we're taking care of high acuity patients. Some of them are intubated. They need high level of care. Some of them are on multiple drips, on cardiac monitors and things like that. So the only real difference I would say is when you're in the ICU, depending where you are, if it's a mixed ICU, you can both have surgical patients and medical type IC patients together. Smaller hospitals tend to mix up their ICUs if they're a really small hospital. However, larger health systems tend to separate their ICUs. They have a medical ICU, which is called MICU, a surgical ICU, which is called SICU, so SICU and MICU. And then if they're bigger, they can even spread it out even more. Sometimes they'll have a cardiothoracic ICU, a CT ICU, which is mostly post-cardiac patients. They might have a neuro ICU where they're only taking care of neuro patients. So it's very interesting. It just depends where you are, how big the hospital system is, and you just have to do your research. Now, when it comes to the emergency department, you can be at an emergency department that's kind of like a community type emergency department. And then you can have a bigger health system that is a trauma hospital that sees trauma patients. I'm not going to get into the levels of trauma, but there are different trauma levels. The highest level of trauma is level 1 trauma. I used to be a level 1 trauma nurse. Detroit was one of the busiest ERs that I ever worked in. It was called Detroit Receiving. And the volume of patients were quite a bit. But what it is basically that the hospital is able to give the highest quality care and the most kind of access. And there's a lot of different criteria that they have to meet. Like they have to have trauma surgeons on call in case you have to take somebody to the OR right away for something. So they have to have a lot of criteria that they meet. So if you're interested in trauma, definitely check that out. Let me know, guys, in the comments if you're watching. If this is helpful, put a 1. If you want to add anything, have any comments, questions, any tips for nursing students or new graduate nurses, please put them in there. And also, if you're interested in working in the critical care area like the ICU or ED, definitely contact me. Again, I'm a nurse career coach. You can message me directly on LinkedIn, or you can go to my website and there should be a section to message me, nursefarah.com. But honestly, the easiest way would be to contact me and message me on LinkedIn. Or you could just drop in this chat and put ICU or ED if you're interested, and I'll definitely see that message and get back to you. And then make sure we're connected, because sometimes people will drop comments and then I can't message you because we're not connected. So just follow me or connect with me on LinkedIn. Okay, so I talked about nursing students, talked about certain certifications that you should get. So like IV, ACLS, PALS, obviously. If you're interested, there's something else called TNCC, which is the Trauma Nursing Care course. But again, I can't remember off the top of my head. I used to be an instructor for TNCC, but I can't remember what the requirement is before you take TNCC. But that is like the equivalence of ACLS, but for trauma. The other thing is, if you're interested specifically in PEDS emergency room, there's another course called ENPC, which is really good. And this is like similar. All the things that I'm mentioning for the ICU and the ED, it's kind of the same. PALS, ACLS. We talked about EKGs, and then we talked about IV certifications, and then stroke. So there are a lot of stroke certifications that you can get. So getting the stroke scale certification would be important. The NIH. Um, what else? What else? So those are some important things. And then let's say that you are an experienced nurse looking to go into the ICU. See if the hospital that you're at has a transition to practice program. Sometimes they do have those, so you can look into that. And then obviously, if you're watching this, you're a new graduate nurse and you haven't applied yet, definitely contact me and I can work with you to make sure that you land that ICU job or that you land that emergency job. Okay. Um, there's certain ways that you need to tailor your resume and your cover letter to be able to get a chance to go to the interview stage. And I know some of you may talk to recruiters and they may tell you, hey, listen, we're not going to hire anybody if you don't have a year experience of whatever the case is. But just because you hear that once from one recruiter doesn't mean that it's the standard for everywhere you go, because it is possible you can get into the emergency room or in the ICU. I recently just worked with a nurse in California, Alicia. She got into the ED as a new nurse, and she's very excited about that. And I've worked with several nurses that got into ICU, and then other positions as well. What else did I want to tell you? Yes, this is what I want to tell you. Nurse residency programs. If you're interested in a nurse residency program, definitely reach out to me. I can help you with that application. Obviously, there's a fee with my services, but we'll go through different packages and see what is good for you. And then there are specific residency programs for the ICU and specific emergency residency programs. And then there are some general residency programs where you can just apply, and then later they'll kind of put you where they think that you fit in. So it's very important to get into residency programs as a new nurse because they provide the most support for you. It's structured in a way that they'll give you a really good orientation and help you support you through that transition. So I highly recommend residency programs. What else? But if you can't get into a residency program, that's okay. Just make sure that the orientation and onboarding is a good enough time. So I would highly recommend for a nurse going into the emergency department, you need at least, and this is a new grad, at least 16, I would say 16 to 20 weeks. So I would say 4 to 5 months of really good orientation. And depending on how the structure is, you might have some classroom orientation and then a clinical type orientation with a preceptor. Same thing if you're a transitioning nurse. Maybe you've worked in another area, but you're not interested in the ICU or the ER. They will help you with your orientation and transition you and make sure that you're comfortable before you're on your own. Okay? So definitely just wanted to just talk about how to be a critical care nurse. Again, quick summary, make sure you join the AACN, which is the American Association of Critical Care Nurses for ICU. And then for the emergency, it's the ENA, the Emergency Nurses Association. They have tons of education, different courses and things that you can take advantage of. And they also have conferences every year. And it looks great on your resume because it shows that you know about them and that you're interested in the area of ED or ICU. So definitely, I would say recommend joining those organizations. Network, like we talked about, in-person networking, virtually. LinkedIn is a great resource. You can get a mentor or multiple mentors. You can get a career coach that can help you with your application process and make sure that your resume and cover letter stand out so you can get through those tracking systems if they do use that and make it into the interview stage where you can slay your interview and be able to land that dream job. So why do I do this? Because, why am I giving you all this information? Because I really believe that you should not settle. Don't settle and say, okay, I guess I'll work here for a little bit and then I'm going to go to the ICU or ED. No, you are capable. You can do it. If you get the right training education, it's possible. So why would you want to waste your time? Don't waste your time in another area that you don't like, right? Especially to all my aspiring ICU nurses. If you want to get into, for example, to be a CRNA and go into anesthesia, you know that you have to get ICU experience. So that's why I say don't waste your time somewhere else. Go straight to the ICU because if that's your goal to get into CRNA school, that's your path. Okay. Also, if you start in the ICU or in the ED, and then you realize after about maybe a year, you're like, I don't know. I don't think this is for me. That's okay. But guess what? You now have such a great foundation, such great clinical skills to be able to move to wherever it is that you want to move to next. Okay? So I hope this was helpful. Sorry, my throat is jacked up. I hope this was helpful. Again, my name is Farah, nurse career coach. If you'd like to work with me, I'll drop down the consultation link of where you can book a consultation and talk more about wanting to get into the ICU or ED, or maybe if you just wanted to get into another nursing position, that's fine. You can contact me as well. Maybe you want to get into an education position, whether it's in academia, at a college or university, or in the clinical setting. I gotcha. I'm a former educator. I was the assistant director of education, then the director of education, worked both in the hospital setting and in academia. Also, if you are a nurse that maybe is just tired of clinical, you don't want to be a bedside nurse anymore, maybe you're looking into entrepreneurship or something like that, contact me. I got you too. And I also wrote a book called Nurses Making Money Moves, a nurse's guide to starting a business. So if you're interested in starting your own business, maybe coach or consultant, definitely check this out. I'll drop the link later in the chat for it. Okay. And then also, I have my 90 day of gratitude journal. You can find it on Amazon. I'll drop the link for that as well. Isn't it cute? It's a hardcover. Because I'm all about gratitude, manifesting, and really writing things down. And then what else do I want to add on? So I will be on tomorrow. I have a special guest. We're going to be talking about community in nursing and as a nurse and community for the nursing leaders out there. And her name is Meaty. You don't want to miss this one. It's going to be great. It's going to be at 12 noon. And then what else do I got coming up? I'll be speaking in Nashville, God willing, on personal branding in August. And I will be speaking for an organization in Canada for Nurses Week. I'm also a speaker, so if you happen to be watching this and you need a speaker for your next event, nursing event, conference, whatever it is, definitely reach out to me. Or if you know somebody that might need a dynamic speaker, you can definitely refer me. You can go to my website, nursefarah.com. And if you're a new nurse looking for mentorship, I have a mentorship program that's going to be launching very soon. Let me know if you're interested. You could put mentorship in the chat. It's going to be a paid program, but it's super cheap. It's going to be $300 for 6 months, and that's only for the first cohort. After that, it's going to go up a lot higher, and we're going to be meeting monthly on a Zoom call, going through different topics, nursing topics, and also having different special guests come through, and then an opportunity for question and answer, and then a chance for community, right, to have new grads all together in one space. All right, and then I'm also, like I said, accepting new clients at this time, limited clients. So if you're interested, definitely reach out. And I think that's pretty much it. Again, I thank you for watching the Nursing Dose with Farah. Until next time, have a great day. Take care.